The reason that we don't know is that nobody's bothering to check, to learn about it. Nobody's bothering to do the research. There are a few organizations, the National Center for Transgender Equality, the National Gay and Lesbian Task Force, and a couple of other transgender legal organizations that are doing some research, but it's not medical or psychological. It's simply based on looking at social trends and legal trends. Any kind of treatment for transgender is still an experimental, quote-unquote, procedure, even though surgery has been taking place for almost 60 years, and transgender treatment predates World War II. As a result of that, almost a third of transgender people get their hormones and other medical medications on the black market. The risk of black market drugs is that they're not pure, or that somebody is selling you something that can kill you rather than help you. Breast enhancement is a $3,000 to $5,000 procedure. Most transgender women can't afford that. So they have what's called pumping parties, where they go and they get silicone from the hardware store or from the auto parts store, and they inject that in order to increase the size of their breasts and their hips. Because they're hoping that that will help them to be able to pass in society and not get beat up. Other medical issues, HIV and STDs. One of the highest rates of HIV is among transgender women who are street prostitutes because they can't find a job, because they can't support themselves in any other way. They have to go on the streets. Substance abuse, Stuart already talked about. I know many transgender people who, once they make their transition or once they start their transition, they're able to quit alcohol, drugs, tobacco, because that was how they were medicating the pressure they were feeling. And once they relieve that pressure, they're able to quit the abuse of the drugs that they've been doing. Okay. In the mental health field, transgender people, more than anybody else I know of, face loss of everything in their lives. When a transgender person comes out, they will invariably lose some of their friends. Many of us lose all of our friends and have to start over with our social networks. Our families, some of them are accepting, some are not, and some are a mix in the middle. And we don't know who is going to be on our side when we tell them who we are. I was very fortunate. When I told my parents, they were very supportive. My ex-wife, not so much. I have friends who've been totally disowned by their families entirely. They're not invited to reunions. They don't even know the status of their children. In my case, if any of my 3 children were to die, my ex-wife would not tell me. Only a gay friend of my daughter's would let me know if something happened to her. Churches, jobs, anything else we have, we're at risk of losing, simply by saying, I'm a girl, I'm not a boy. And not to mention the fact that the earnings changes for transgender people, our earnings drop more than just the 22% that is between male and female. Very high level of depression and suicide attempts. In Tucson, half of all transgender people have attempted suicide. That's half of the people surviving long enough to say whether or not they have. We don't know how many transgender people actually have completed suicide attempts, because most of that is reported as a male or a female based on the physical genitalia. Who wants to be the coroner that tells a family that they're not sure whether it's a son or daughter committed suicide, or that their son, who was physically wearing a dress, committed suicide? Because They don't know the family. They don't know whether the family is accepting or not. And they want their job to be as easy as possible, just like any of the rest of us. So those numbers are not kept. And the good news is that in 2008, the American Medical Association adopted Resolution 122, which says that gender identity disorder is a recognizable medical condition, and that all of the surgical needs, all of the medical needs, should be covered based on medical necessity. And the World Professional Association for Transgender Health, WPATH, went into even more depth as to what that meant. But is anybody listening? So far, no insurance company, nobody else has jumped at the opportunity to say, hey, that's right, we'll support that.